Welcome to 5-Minute Fundamentals. This short lecture provides an overview of key concepts from Pearson's medical language, Immerse Yourself, by Susan M. Turley. Please note, this is a brief summary. It's not a replacement for the full review. For deeper understanding, examples, and practice, be sure to read the textbook and explore the complete resources available on Pearson's MyLab. Now, let's scrub into today's 5-minute focus. Blood is essential to life, delivering oxygen, nutrients, and removing waste from every cell. It contains erythrocytes, leukocytes, thrombocytes, plasma, and other components. These are all produced through a process called hematopoiesis. Erythrocytes are the most numerous, produced in bone marrow, and contain hemoglobin, which carries oxygen. They lack a nucleus, so they can't divide or repair, and their production is stimulated by the hormone erythropoietin. Leukocytes include 5 types: the granulocytes, which are neutrophils, eosinophils, and basophils, and agranulocytes, including the lymphocytes and monocytes. Platelets are cell fragments crucial for blood clotting. Plasma, the liquid part of blood, makes up 55% of its volume and transports proteins like albumin and electrolytes, such as sodium, potassium, and calcium. The lymphatic system, which supports immune function, includes lymph fluid, vessels, nodes, and organs like the thymus and spleen. The thymus matures T cells, while the spleen recycles old red blood cells and stores blood and immune cells. Blood clotting is a vital defense mechanism that prevents excessive bleeding after injury. It begins with platelet aggregation, where thrombocytes clump at the injury site. And these platelets release clotting factors to form fibrin strands, which trap red blood cells and create a thrombus. This process is called coagulation. And once clotting is complete, serum remains as the clear fluid of plasma without the clotting proteins. The immune response defends the body against pathogens like bacteria, viruses, fungi, and more. Leukocytes play key roles. Neutrophils and monocytes engulf and destroy invaders. Eosinophils target parasites, and lymphocytes like B cells, T cells, and NK cells coordinate attacks. Antibodies mark pathogens for destruction, while complement proteins punch holes in foreign cells. In allergic reactions, histamine released by basophils and mast cells causes symptoms ranging from mild local swelling to life-threatening anaphylaxis. So get ready, we're going to go through this fast because there's a lot to cover. Common blood and lymphatic system diseases include pancytopenia, septicemia, anemia, transfusion reaction, coagulopathy, hemophilia, thrombocytopenia, lymphadenopathy, lymphoma, splenomegaly, thymoma, type 1 diabetes, Graves' disease, Hashimoto's thyroiditis, multiple sclerosis, rheumatoid arthritis, acquired immunodeficiency syndrome, deep vein thrombosis, and disseminated intravascular coagulation. Common blood cell tests include complete blood count, type and cross-match, coagulation time tests, blood chemistry tests, ferritin, enzyme-linked immunosorbent assay, monospot, and serum protein electrophoresis. Urine tests include urine protein electrophoresis and the Schilling test. Radiologic procedures include lymphangiography. Medical procedures include blood donation, a blood transfusion, phlebotomy, plasmapheresis, stem cell transplantation, and vaccination. Some medications include anticoagulants, corticosteroids, erythropoietin drugs, nucleoside reverse transcriptase inhibitor, platelet aggregation inhibitor drug, protease inhibitor, thrombolytic enzyme, and vitamin B12. Some surgical procedures include bone marrow aspiration or transplantation, lymph node biopsy, lymph node dissection, splenectomy, and thymectomy. Whew, we made it with just a few seconds to spare.